He had a personal experience with a nurse practitioner, is aware of the role of the nurse practitioner, and through, I think, the guidance of Dr. Gutman and others, really felt that this was the best use of the money to really hopefully educate the next generation of providers, which is what we're doing at Penn Nursing and what we hope to expand on. The primary care shortage has been well documented. I think this is not new news to anyone in the country. I think for every one physician who goes into training to work in primary care, and even in an underserved community or with underserved population, for every one physician, there's 10 nurse practitioners. And so nurse practitioners in probably the last 10 to 15 years have really risen to the occasion to serve in those areas where providers could not be found. You could have, in some rural environments, a nurse practitioner for 100 miles between another provider. What one colleague, a physician colleague, said to me recently was, Sue, you do understand that nurse practitioners are the problem, the solver of the problem of primary care, and that the model will become, for every 10 nurse practitioners, you'll have a physician in a practice who has perhaps 10, maybe even more advanced practice nurses working with them to meet the needs of the population. He said that's where we're going. We've been going there for years, and that's why we so desperately need more nurse practitioners educated to fill those roles. The demand for preceptors is a challenge that face many nursing schools in the Philadelphia area, including ours. And how we plan to address that is really looking at our alumni. We give graduates a year to practice before we bug them about precepting, and we're really trying to build our precepting network so that we can expand enrollment in all of our primary care tracks. I mean, the reality is, and this is not unique to Penn Nursing, this is a challenge for all nursing schools to find qualified preceptors. It is our responsibility as a school to find and vet preceptors for our students, because they know when they come to Penn Nursing that that's one of the core values of our programs and one of our responsibilities to make sure they get a sound clinical experience. I know that in 2020, it was one of the biggest concerns once we switched to kind of virtual learning. One of my greatest joys that summer and the following summer was to have women's health students doing their primary care rotation with me. And my practice is in long-term care, but I have an ambulatory group of residents that I see. And I had many of the women's health students rotate through my site, and they were just exceptional students. They were smart and they were motivated, and really I knew that they were going to make us proud once they were graduating and going out there to practice. Having an opportunity to study to be a nurse practitioner without the worry of loans and how are you going to pay tuition, because graduate school is expensive. So for an applicant to come to apply to Penn with perhaps an opportunity to go through their graduate education without any debt and become an advanced practice nurse in 15 to 18 months is just a tremendous opportunity. I can't tell you how excited I was to hear about this gift, because I knew that, and I'm already seeing on social media, and I'm getting many emails every day from alumni who are, asking, like putting out there to potential students, if you're ever thinking about going back to school and you thought about Penn and you want to be a primary care provider, now's the time.